Domestic violence profoundly impacts individuals, families, and communities, demanding urgent attention from mental health professionals. This episode, complementing Therapy Training's DV Kentucky course, provides counselors, therapists, and mental health practitioners with essential knowledge to address this critical issue. We'll examine the dynamics of abusive relationships, explore trauma-informed approaches to treatment, and discuss Kentucky-specific laws and resources. You'll gain practical skills for identifying signs of domestic violence, supporting survivors, and implementing effective interventions. This comprehensive overview will enhance your ability to provide compassionate, informed care to those affected by domestic violence in Kentucky and beyond. In this episode, you'll gain a deeper understanding of the dynamics of domestic violence, recognize the signs and red flags, explore the impact on mental health for survivors and their families, and learn culturally sensitive approaches for working with diverse populations. We'll also discuss trauma-informed care strategies, screening tools, safety planning, legal considerations, and the importance of self-care for professionals working in this field. So whether you're a seasoned practitioner or just starting your journey in mental health, there's something here for everyone. Let's start by unpacking the dynamics of domestic violence. It's important to recognize that domestic violence is not solely physical abuse. It encompasses emotional, psychological, and financial abuse as well. The power imbalances within abusive relationships can manifest in many forms. For example, a partner may exert control through threats, isolation, or manipulation, creating a toxic environment that can be incredibly difficult for the victim to escape. Have you ever thought about how many different layers there are to power dynamics in relationships? It's crucial to understand these layers to effectively support survivors. The abuser may use tactics that leave the victim feeling trapped, confused, and powerless. The course emphasizes the importance of understanding these dynamics so that you, as a mental health professional, can recognize the signs when they present in your clients or their families. Speaking of signs, let's talk about red flags. Many individuals may not even realize they are in an abusive situation until it escalates significantly. Some common indicators include excessive jealousy, frequent checking in, sudden changes in behavior, and isolation from friends and family. If clients express fear about their partner's reactions, or if they feel they cannot make decisions without their partner's approval, these are serious signs that warrant exploration. Now, let's pivot to the impact of domestic violence on mental health. Survivors often carry emotional scars that can manifest as anxiety, depression, PTSD, and other mental health disorders. Additionally, children who witness domestic violence can experience profound effects, including behavioral problems, emotional difficulties, and an increased risk of developing mental health issues later in life. Imagine a child who grows up in an environment filled with fear and uncertainty. Their perception of relationships may become skewed, leading to difficulties in forming healthy connections in the future. As mental health professionals, we must be aware of these potential impacts and approach each case with sensitivity and compassion. In Therapy Training's DV Kentucky course, we stress the significance of culturally sensitive approaches. Domestic violence doesn't discriminate. It affects individuals across all demographics. However, cultural backgrounds can influence how victims perceive their situation, seek help, and access resources. Understanding these cultural nuances is crucial in providing effective support. For instance, in some cultures, discussing family issues outside the home may be taboo. This can create barriers to accessing help. As a therapist, it's vital to approach each client with cultural humility, acknowledging their unique experiences and perspectives. This not only fosters a trusting therapeutic relationship, but can also empower clients to engage more fully in their healing process. Next, let's discuss trauma-informed care. This approach recognizes the prevalence of trauma and its impact on an individual's life and mental health. In domestic violence cases, survivors may have experienced multiple traumas, both from the abuse and possibly from external factors, such as societal stigma or lack of support. When working with survivors, it's essential to create a safe and supportive environment. This can involve collaborating with clients to establish boundaries and ensuring they feel in control of their treatment. Trauma-informed care emphasizes empowerment agency, and a client-centered approach, which is particularly important in cases of domestic violence. Now that we've covered some foundational concepts, let's touch on screening and assessment tools. Identifying domestic violence can be challenging, especially if clients are not forthcoming about their experiences. Familiarizing yourself with appropriate screening tools can aid in this process. For example, the Danger Assessment Tool is a widely used instrument designed to help assess the risk of lethality in domestic violence situations. Other screening tools can help identify emotional abuse or control tactics that may not be immediately apparent. It's essential to approach this process with sensitivity, ensuring that clients feel safe and supported throughout. Speaking of safety, let's talk about safety planning. This is a crucial step for survivors, especially those who may be contemplating leaving an abusive relationship. A safety plan can include practical steps, such as identifying a safe place to go, packing an emergency bag, and having essential documents readily available. As mental health professionals, you can play a pivotal role in helping clients develop a comprehensive safety plan. This not only empowers clients, but also helps them regain a sense of control over their lives. Moreover, understanding available resources in your community, such as shelters, hotlines, and legal aid, can significantly enhance your support for these individuals. Now, let's shift gears to legal and ethical considerations. When working with domestic violence cases, it's essential to be aware of your legal obligations, including mandatory reporting laws and confidentiality issues. You might find yourself navigating complex situations where the safety of your client, their children, or even themselves is at stake. Ethically, it's crucial to advocate for your clients while respecting their autonomy. Supporting clients in understanding their rights and options can empower them to make informed decisions. This balance between advocacy and respect for autonomy is often delicate but vital in the therapeutic process. As we move toward the conclusion, I want to highlight the importance of collaborative partnerships with community organizations. Addressing domestic violence is a multifaceted issue that often requires a community response. By fostering relationships with local shelters, legal aid organizations, and support groups, you can create a robust network that benefits your clients. Collaboration can enhance the resources available to survivors, ensuring they receive comprehensive support that addresses their physical, emotional, and legal needs. This systemic approach is essential in tackling the root causes of domestic violence and creating lasting change. Before we wrap up, let's address some common misconceptions related to domestic violence. One prevalent misconception is that domestic violence only occurs in certain socioeconomic groups or demographics. In reality, it transcends age, race, and economic status. This myth can perpetuate stigma and make it harder for individuals to seek help. Another misconception is the belief that victims can simply leave if they want to. In truth, leaving an abusive relationship can be incredibly complex and dangerous. Many factors, including fear, financial dependence, and emotional ties, can keep someone in an abusive situation. As mental health professionals, it's crucial to approach this issue with empathy and understanding, recognizing the complexities involved. As we wrap up this episode, I encourage you to reflect on the insights we've discussed today. Domestic violence is a pervasive issue that requires our attention and action. By understanding the dynamics of abuse, recognizing the signs, and employing culturally sensitive and trauma-informed approaches, we can make a difference in the lives of survivors and their families. If you're interested in diving deeper into these topics, I highly encourage you to explore the DV Kentucky course offered by Therapy Trainings. It's a fantastic resource for mental health professionals looking to broaden their knowledge and skills in this critical area. Thank you for tuning in to today's episode. Remember, the work you do is vital, and your self-care is equally important. Take time for yourself, seek support when needed, and continue to advocate for those affected by domestic violence. Together, we can create a safer and more supportive environment for survivors. Don't forget to visit therapytrainings.com for more courses that empower you in your practice. Until next time, take care and keep advocating for mental health and wellness.